Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, welcome back. We are in full effect and really excited to bring this episode to you. We got Dr. Philip Ovadia, cardiac surgeon that has transitioned his clinic to be virtual to improve metabolic health for his patients. And what I love about this is it's scalable. He talks about how passionate he is on preventing people from landing on his operating table. You hear us talk about this all the time, how metabolic health lands you in ICU and so forth, worsening COVID outcomes, for example. He's seen it. He's lived it, and he's trying to make a difference. And his story is quite remarkable. He talks about being overweight and losing 100 pounds when transitioning to low carb and carnivore. What difference it made in his life and wanting to really recreate that for people all around him. And like I said, he's making a difference. He's an author. The name of his book, Staying Off My Operating Table. He's got a podcast, which you'll hear about too. Just a remarkable human being. Got to connect with him at the Metabolic Health Summit, which was gangster. It's fantastic. So really excited to bring him in the mix. Just a little plug, Solving Wellness, folks. Check out our Facebook page, facebook.com/groups/Solving Wellness. That's our free community. Go to solvingwellness.com for our paid service where you get the online workouts, yoga sessions, stress management tips, mindful meditation. Get it all. And like we said many a time, we're trying to change the boogie. You know what I'm saying? All right. So without further ado, let me bring Dr. Philip Ovadia. Quadcast Nation, we have a very special guest. We got Dr. Phil Ovadia, cardiac surgeon. This gentleman, I'm really proud of, not only because of his personal story, but how he is changing the landscape of people's health, people's metabolic health, thinking outside the box to get us all healthier. So, Phil, welcome to the show.
Great to be here with you, Quad. You know, this is really exciting for me. We recently connected, first on social media and then fortunately in person. We were at a meeting together, and I just love the energy that you're bringing to this. And I love seeing the new physicians that are coming to the metabolic health space and coming into the conversation, and, all these different specialists that are realizing the importance of metabolic health and how we as physicians should be better serving our patients by not managing their disease, but by actually helping them to get healthy.
Yes. I get, just hearing that gets me so excited because it's a pivot. It's a change of perspective. It's, hey, yeah, let's not stop thinking about just managing your metabolic issues, your diabetes, your hypertension. Let's fix them. Let's resolve them. Let's get you back into where you need to be. Like, this is the change in perspective that more of us need to have. So honestly, it's exciting to have this conversation with you. And maybe a good place to start is just your personal story with metabolic syndrome, because I think hearing your story, it really gives perspective on why you're so passionate about this.
Yeah. So, my personal and my professional stories certainly have merged, I would say, over the past few years. But, on the personal side of things, I struggled my entire life with obesity. I was overweight as a child. And this was despite the fact that, me and my family were following the standard advice. I was very active as a child. I played sports year round. I rode my bike places and walked places. And our household, ate according to the U.S. dietary guidelines. Important to note, I have an older brother who's a type 1 diabetic. So we had no sugar in the house. We had all of the low fat, skim milk and margarine instead of butter. And, we had our heart healthy Cheerios every morning. And despite that, me and my entire family were obese. And, as I went through my medical education, I realized what a problem this was. And I tried a number of times to lose weight. I did, exactly what we learned in school. I ate less. I moved more. I counted my calories. I ate a low-fat diet. And I would have some short-term successes and I would lose some weight. And then I would always gain it back and more. And fast forward, 15 years into my career as a heart surgeon, taking care of people, operating on people every day for, these issues. And yet I was struggling more and more with them myself. And I had gotten to a point where I was morbidly obese. I was pre-diabetic. And I knew that I was going to end up on my own operating table, so to speak. And fortunately, at that time, I started to come across some alternative ideas about, why we get unhealthy, why we get obese. I actually was attending a medical conference where Gary Taubes was the guest speaker. And quite frankly, at first, I was sitting there in the back of the room thinking, why is there some journalist talking to us at a heart surgery conference? But, Gary started talking. And of course, he had at that time just written The Case Against Sugar. And prior to that, why we get fat and good calories, bad calories. And what he said made sense. What he talked about, that the types of food that we are eating are more important than the amount of food that we're eating, and the types of food that we're eating influence the amount of food that we're eating. It all made sense to me. And I read the books and I started eliminating sugar and processed carbohydrates and processed food. And eventually I was able to lose 100 pounds. I have now maintained that weight loss for, 6 years. And I was awakened to the fact, I guess you would say, that, the struggle that I had been going through and the reason that these, all of the things that I had learned in school weren't working for me was the same reason they weren't working for my patients. And I started talking to patients about it and talking, friends and family about it, and they all started having improvements as well. And then I started asking those big questions, like, why didn't I learn this in medical school? Why did I hear this first from a journalist, instead of one of my medical school professors? And, that has really opened my eyes to the failures of our healthcare system and how we have become so focused on just trying to manage disease. We have lost sight of the fact that we can actually reverse and prevent these diseases in the first place. And specific to me as a heart surgeon, I came to realize that almost every patient I was operating on had been failed by the healthcare system. And in the vast majority of cases, we could be doing things that would prevent the need for heart surgery. And so that's why I've, kind of added an additional component and refocused my career on helping people to stay off of my operating table.
Oh my goodness, I get goosebumps because, both of us were very adamant on I'm passionate about avoiding seeing our patients. And like, to put it in perspective, like I talk all the time about how challenging an ICU admission is, from, being on a ventilator, the pain, the anxiety, the PTSD, if you survive it, the profound, deconditioning. You're not the same person when you leave an ICU. Going through cardiac surgery ain't no walk in the park. You know what I'm saying?
Yeah, exactly. And again, one of the things that I, have come to grips with, I always realized it, but, I've never really, talked about it, is that we know that no matter how good a surgeon I am, no matter how good all the heart surgeons out there are, you're never as good after the surgery as you would have been if you never needed the surgery in the first place. And we know that the, natural history of heart disease is that once you have open heart surgery, once you have bypass surgery, you are very likely to have future problems, more blockages develop, need surgery again, need stents again, something like that. So even, so again, that caused me to step back and question, what are we doing? We're simply putting a Band-Aid on the problem, and we're not addressing the root cause. And all of these things that, we have focused on, controlling people's cholesterol and taking all the medications and whatever it is, it's not preventing them from still having problems, related to the heart disease. So it's time that we start questioning those basic assumptions, about what the root causes are, and then starting to address those root causes so that even the people that end up on my operating table don't need to end up back on my operating table.
So, I mean, to dive into it a little bit more, Phil, like when you say, like, get to the root cause, like when somebody comes for their triple bypass, quadruple bypass, they're pre-diabetic, and so, like, what specifically, when you say root cause, what are you referring to exactly?
Yeah, so I want to be able to figure out, what is it? What is the factor that caused that patient to get there? Because that then allows us to figure out what can we do to change that factor. And unfortunately, for a long period of time, I think, specifically in the heart disease world, we've been focused on the wrong factor. The singular focus around preventing heart disease is pretty much lowering cholesterol. And while cholesterol is certainly part of the process that leads to heart disease, we see that lowering cholesterol is ineffective. Many of the patients that, end up on my operating table. And again, we have all the scientific studies that show, patients that come in with heart attacks, patients that end up having heart surgery, many of them have what are considered normal cholesterol levels, low to normal cholesterol levels. Some of them because they're taking medications to lower the cholesterol. Some of them just because, they have naturally low cholesterol levels. Some of them have made dietary changes to lower their cholesterol. But whatever it may be, they still end up on my table. And the other curious thing that, I started to encounter more and more as I got into the metabolic health space is that there are lots of people who are walking around with very high cholesterol levels that never develop heart disease. So, we have these outliers, we'll call them, on both sides of the equation. And that caused me to step back and think, okay, maybe it's not all about cholesterol. And then when you really do start digging into the literature around heart disease, you see over and over metabolic health, insulin resistance, diabetes, all of these things, which are really, just different ways of looking at the same basic problem. And we see that these are much bigger predictors of the risk of heart disease than LDL cholesterol. Elevated LDL cholesterol levels are. So that's why it troubles me so much that we don't focus on this and we don't tell people, you need to be reversing your diabetes. You need to be avoiding it in the first place if possible. Your high blood pressure, all of these things we know are reversible now. And with the metabolic health interventions, you can reverse these underlying conditions. And that is what is going to give the patient the lowest risk of, developing heart disease in the first place or worsening heart disease if they already have it.
Yeah, that's brilliant. So like what I'm hearing from you, Phil, is that, when it comes to root causes, like if you're going to be 80-20 or most efficient, if you could deal with people's metabolic health overall, you're going to prevent them, more likely to prevent them from getting sick, from landing on your on your table, landing in ICU, as we talked about. And I guess that was something that has been so enlightening to me too, is that we weren't posing this question enough. Like, what can we do beforehand? And I mean, Phil, you referred to this before. We don't learn this shit in med school, man. We don't learn this shit in residency either. And I guess the question is, why aren't we learning this? Like, I'm finished residency in 2005, and not till COVID was when I would start to learn about this stuff. And I mean, you and I were talking at the summit. That's crazy to have to learn some of this content so deep into a career, or needing a pandemic to highlight some of these concerns. So why do you think we don't learn this? Why don't we learn this stuff?
Yeah, and that's a big question that keeps coming up for me, because I finished training right around the same time you did, 2005. And it wasn't until 2016 when I stumbled across some journalist, that I heard all this. And then I started learning even more from it, from, guys like computer scientists and engineers. And, thankfully I was also able to tap into the growing community of physicians who talk about this. But this stuff is not talked about. And not only is it not talked about and not taught in schools, it's actively discouraged. I still get a lot of pushback for talking about things, saying things like cholesterol may not be the most important factor in the development of heart disease. That basically ostracizes me from the, mainstream cardiac community. I'm certainly not going to be invited anytime to the American Heart Association to, give a talk on that or give my perspective and show the evidence on that. And the evidence is out there. One of the other things that has sort of distressed me about this whole process as I've gone through it is you go back to the medical literature, and there is plenty of evidence of, all these things that we talk about, specifically if you want to talk about the relationship between insulin resistance and metabolic health. Gerald Reaven did extensive work, and published extensively, 1970s, 1980s, 1990s. At that time, he was calling it Syndrome X, but it's now what we call metabolic syndrome, and shows a very clear relationship between the metabolic syndrome and heart disease. And then all of a sudden, and there are lots of other people talking about this in the 1980s. And then all of a sudden, in the late 1980s and the early 1990s, the entire focus of the heart disease literature switches to cholesterol, and specifically LDL cholesterol and lowering LDL cholesterol. And, the only reason that might be, the only reason that I can figure out that happened was because all of a sudden we had a bunch of drugs that came out that lowered LDL cholesterol, and that became the narrative. But I can understand that. I can say, great, we thought we had the answer. We thought we had the miracle cure. We got all these medications, but here we are 30 years later, heart disease is still the number one killer in the United States and worldwide. And it's hard to show that we've had any impact whatsoever with that, singular focus on cholesterol. So, you start to get into the bigger questions about who's really directing what we learn in medical school, who's really controlling what we're able to talk about as physicians. And, very quickly you start to realize that what might be the best interest for the patient is not necessarily the best interest for the healthcare system.
Yeah. So, I mean, personally, I think it's grand that we're continuing to have these conversations, more highlights on reversing metabolic syndrome. And I think awareness is where we begin, and hopefully we're all putting a dent on that. You got your book, you got your clinic, which we'll dive into a little bit more. But in terms of your personal story, you gave examples of how you got to losing 100 pounds, which you look fantastic, by the way, in the flesh. What are some of the strategies that come to mind when you're addressing your patients? Like when you want to try and reverse their metabolic syndrome, their type 2 diabetes, what are some of the things that you put on the table?
Yeah. So, I try and keep it pretty simple. I don't give people the 28-day, Dr. Ovadia diet plan. But what I do give them is a framework to work within. And, it's pretty clear. As much as, the diet wars all seem so confusing and there's all this information out there about this is the best diet, this is the best diet. When you look for the commonalities among dietary strategies that are successful, it really comes down to eat whole, real food first and foremost. Processed food continually shows up as, the biggest risk factor for obesity and diabetes. So I start high level and I try to get patients to really think about, what they are trying to accomplish around their health, and not be so focused on short-term goals like losing, X amount of pounds, but really trying to get in that mindset of, I want to be healthy. I'm going to find the habits that are going to support my health. And then, those habits really start with, first and foremost, eat real food. I tell people to eat the things that grow in the ground and eat the things that grow in the ground. So, these are your plant products. These are your animal products. The balance between the two, there's a lot of latitude there. And there are a lot of factors that go into it, where you're starting from, how metabolically broken, or unhealthy you are to start with, what your personal preferences are. But I talk about it in the book, and, in my practice with the patients I work with, I literally have carnivores and I have vegans and I have lots of things that are in between. And there are ways to find success with each of those strategies. And, in the end, I focus people on the metrics of metabolic health and getting metabolically healthy. And that's what I think leads to the long-term successes that we are looking for.
Yeah, Phil, you highlight two things that I think really are important. Number one, the emphasis of whole foods. Like, I really think that's underappreciated how much junk is in non-whole foods and processed foods, and how rampant processed foods are all around us. Like, now I look back at my childhood, it's like basically processed. And the second part that I really think is intelligent approach is the personalization. This is one thing that often gets overlooked, is you got to look at the person or the patient in front of you and determine what's going to work best for that patient. Not just, it's not going to be cookie cutter. It's not going to be a recipe that everybody can adopt to. It's not all keto. It's not all plant-based. It's what you think can work for that patient that's going to lead to success. And I just think that's another component of this that we need to really embrace. moving forward for sure.
Yeah, definitely. I think one of the, other places that we've sort of, gone off the rails in medicine is this concept that everything should be, protocol based and check boxes and guidelines, and that every patient is the same and that they're going to respond the same. And we know we have to remember we are dealing with human beings. We're not dealing with computers. We're not dealing with automobiles or airplanes that are, the same every time. As in the ICU, in the OR, there's been, this big emphasis to kind of adopt a lot of the safety standards from the airline industry. And we've got in the checklist, and, we see this actually pervasive through medicine. But the difference is that when a pilot sits down at the cockpit of a plane, that plane, they know the model of that plane, and therefore they know exactly how that plane works. And it's been finely tuned, and it's kept within, all the parameters to make it so every time they fly the plane, that plane is going to fly the same. And every time they do whatever movement with the controls, that plane is going to respond the same. But that's not how humans work. So this concept that we can just have these cookie cutter recommendations that should be applied to each and every patient without questioning, without thinking about them, is nonsensical, really. And it's the antithesis of what medicine is supposed to be. And we as physicians need to start fighting back against that, because we need to be able to do things individually with our patients and realize that each patient is truly unique, and it's our job to figure out, what the best thing for that patient in front of us is.
100% personalized, precision-based care. This is a future. I mean, you hear me say this on the show all the time, but, how do you know, like when we look at a study and they say aspirin is beneficial in this circumstance, this is on average. It's not telling that every person that comes in as a patient that receives aspirin is going to have that positive outcome. And what we don't do in medicine and research enough is asking ourselves, which of these patients is most likely to respond to the treatment? Which one is most likely going to respond to low carb? Which one's most likely to respond to keto? We need to, the paradigm needs to shift. We need to ask ourselves, the person in front of you, how are they going to respond, and what's going to be the best treatment for them? Because I'll tell you, I've seen negative outcomes from protocols when people forget to think. Oh, one of the common ones, Parkland formula in burn patients. Oh, I'm supposed to give this much fluid. I'm like, the patient's drowning. Stop the fluid. You know what I mean? Like it just really, we need to start thinking outside the box, and this is exactly where we need to go. Personalized, precision approaches to not only what we're talking about here, metabolic health, but in general, 100%. So I wanted to get into your clinic in general. This was the other thing that, I feel like we're cut from the same cloth, Phil, because, you acknowledge there's a problem and you are going at it unconventionally, different approaches to try and address these things. Tell us a little bit about your clinic and how you're addressing metabolic health that way.
Yeah, sure thing. So, again, when I had this realization that I needed to be helping people to stay off my operating table, as a heart surgeon, I'm not given the ability to do that because patients only come to me at the time that they need heart surgery. So, I was looking for ways to do that. I decided to start a telemedicine practice where I can now work with patients before they get to the point of needing heart surgery. And we focus on metabolic health and lifestyle and dietary interventions to help them avoid the need for heart surgery. And, that's been an interesting journey, going from spending my career as an employed heart surgeon, I always worked for healthcare systems, to going out on my own, starting a practice, starting a telemedicine only practice, which, as much as we talk about telemedicine, and as popular, I guess you could say, as telemedicine has become, especially with COVID, there are still very few telemedicine only practices out there. And there's lots of challenges around the licensing and the software and all of that stuff. But I've done it. The practice has been up and running for about 18 months now. It's been very rewarding professionally, because again, I am actually helping patients. We are seeing them reverse their diabetes, get off their high blood pressure medications. And we're seeing, improvement in their heart disease. I have patients who are lowering their coronary artery calcium scores. And that's not supposed to be possible, we're told. So those are all very rewarding things, for me professionally, and of course for the patients themselves. And it really, is empowering for these patients to learn that they can reverse these conditions, they can improve these conditions, and that they have the control over that. They are the ones that are making the changes that allow them to do that.
And what I like, Phil, too, is the scale. Like you're not having to just be in Florida to see patients now. You can see them from across the country and impact lives that way. And I think that's a very valuable, underappreciated component of all this. And I'm curious, walk me through what it's like to go through a clinic like that. Because, we were at the Metabolic Health Summit. You're getting all these devices that people might use, CGMs potentially. What is kind of the roadmap or for potentially for some of your patients?
Yeah, so I do, certainly leverage some of those technologies, and we, obviously doing all the care remotely, brings up a couple of opportunities to improve the way that care is delivered. So, patients find me in many different ways. I'm active on social media, and I have the book and things like that. They go through the process. I have initial sort of calls with them to see if, my practice is right for them and they're right for the practice, and they sign up, and, we have, it's a concierge type model. So we're not dealing with insurance. We don't have the insurance companies in between the patient and I telling us what we can do and how much time we can be spending. I have, pretty extensive visits with patients. My initial consultations usually run about 90 minutes. Follow-up visits, are 30 minutes, 45 minutes, whatever they need to be. In between visits, I have a secure messaging platform that the patients use, that they just send me a question and I respond. There's not a lot of buffers in between me and the patients. I'm in the process now of bringing on some health coaches and stuff to help out with this whole process. And, on some levels, it's very advanced because we are leveraging technologies like the continuous glucose monitor and remote blood pressure monitors that, are reporting back to a dashboard, and their scales are connected to my dashboard. And, we're getting all this data from all these technology tools. But on the other hand, it's very old school. It's very much back to the doctor and the patient sitting there together. And yes, we're across the screen, but we are sitting there together and we are having the conversations about, what we need to be doing to improve their health. And I think most patients, find that very refreshing and very different from, what they are used to. And many of my patients remark to me, why aren't my other doctors like this? Why aren't their practices like this? And unfortunately, I don't have a good answer for that.
But hopefully this is I mean, this is why we're on doing this, is that we get the word out, we get people's minds percolated and saying, why aren't we creating an environment where I could get access to care like this, reversing my diabetes, my obesity, hypertension, and once again, avoid getting sick. And so, yeah, once again, want to commend you big time for putting this together. I'm wondering if do you have a sense of the impact? Like, do you have a story that comes to mind when you think about, that 18 months that you've had doing the clinic? Like, anything come to mind from that perspective?
Yeah, I mean, certainly the patients who already, within just a year, have noticeably, measurably impacted their heart disease. So, the patients who have had CAC scores, coronary artery calcium scans, and we know that the natural history of, coronary artery calcium scans is that they increase 10 to 25% a year. And, one recent patient who, in his early 60s, and he came to me with a elevated coronary artery calcium scan score, and we made the changes. We, over the course of a year, he lost some weight. He got off his blood pressure medications. And most importantly, when we got his repeat scan a year later, his coronary artery calcium score had actually gone down 17%. So that was pretty impressive. And of course, the patient was thrilled. And, it's not over. We still need to be following along and continuing the changes. But it's a great impact. And it puts him on the road of not ending up on someone's operating table when previously he was on the road towards, needing some sort of cardiac intervention. And he was very likely to develop a cardiac event. And then there were just the other basic things that I see, almost, they've become routine now, that patients come to me and they're type 2 diabetic and they're on multiple medications, and pretty quickly, within a few months, we can usually get them off their medications or significantly reduce their medications with better blood glucose control, lowering hemoglobin A1Cs from 10 and 11 down to 5 and 6, while lowering medications. And these are things that certainly I had never even known was possible as a physician until I started getting into this metabolic health space.
I still to this day, exactly as you put, didn't know this was possible as a physician. I still to this day can't believe some of this, that this has escaped our radar. But I love hearing those stories. I love hearing the, grandma coming off her diabetic meds. I love hearing Uncle Rick coming off their antihypertensives and feeling good and looking good. And it really is remarkable. And I really think if more people knew about the possibilities, that increased awareness, I think we'd get more buy-in. I thought we'd see a bit more of this during the pandemic, if I was being honest. I really thought, especially pre-vaccines, that this would be the time to really put a lens on this. But I must say, Phil, I don't think this got any traction at all, despite many efforts.
Yeah, no, that was certainly one of the most disappointing things to me, looking at the pandemic as well. It was crystal clear early on that poor metabolic health, diabetes, obesity, insulin resistance, however you want to measure it, was the biggest risk factor for not only getting COVID, but getting, sick and complications from COVID. And we had the data from the first days, out of New York, out of Italy, out of China, those first waves. That data was very clear. And I, like you, said, great, this highlights the problem we have with metabolic health. Everyone should be saying, get metabolically healthy. while we work on figuring out treatments and vaccines and whatever else you want to talk about, let's at least start getting metabolically healthy. And yet we did the exact opposite. We told people to stay in their houses. We closed down all the gyms. We, encouraged, eat comfort foods. Here's your free donuts for, getting your vaccine or whatever it was. And we did the exact opposite. Our metabolic health got measurably worse in just that short time period. We see the numbers in terms of the explosion of diabetes and obesity, and especially in our young populations, our children, our teenagers. So we've only set ourselves up for a worse pandemic, down the line, because the other thing we need to realize is that this was this virus, but there's going to be another virus, and these viruses are going to take advantage of the poor metabolic health that is just rampant in our society. And until we address that problem, we're just going to be chasing our tails.
100%. I mean, our listeners, I'm not even going to repeat this because I've said it 5,800 times. I'll just basically acknowledge that Dr. Phil is on point with this one. Couple quick hidden questions that I probably should have asked before. How much do you put into any of the above macros, like percentage macros, like a protein intake relative to everything else? How much do you think about time restricted eating or fasting and exercise or movement? How much of any of that do you consider with your patients? Yeah.
So, I'm not big on tracking macros, but I do, again, kind of give the framework to patients that protein is the most important part of the diet. And, we need to be sort of focused on getting enough protein intake and then constructing the rest of the dietary strategy around it. Intermittent fasting, for me, what I talk to patients about is the way that you eat should make you hungry less often. And this really goes back to the protein issue. Protein, the more protein you eat, the less hungry you're going to be. So when we are eating whole, real food, and when we are prioritizing protein, we just end up being hungry less often. And so then we start intermittent fasting, and I think that's a very powerful strategy. Clearly, sort of the two big levers that we can be pulling in terms of, trying to improve health, trying to lose weight, is eating less often and eating better quality food. And one leads to the other. And so for me, it's a perfect, natural kind of synergy there that I talk about with patients. But I usually start with the eat real food, eat high protein, and then as you get hungry, you're going to fast and eat less often. And exercise and activity, I think, are very important. But again, I tend to look at them a little differently than I think, the mainstream messaging has been. I believe that our priority should be building and maintaining muscle. We have very good data showing that as you age, the more that you are able to maintain muscle, the longer you live and the better quality of life you are going to have. So I ask patients to kind of focus on, resistance exercises. And these can be simple body weight exercises. It can be push-ups, it can be pull-ups, it can be sit-ups, and it can be modifications of those for patients that can't do it. It can just be out walking around. We seem to forget that, working against gravity is resistance exercise. So I tell patients, instead of taking the elevator, go up the stairs whenever you can. Use stand-up desks or get up, every hour, get up and take a 10-minute walk around your office. Just simple things like this have more of an impact than going to the gym for an hour and running or jogging on a treadmill and then sitting around the rest of the day doing nothing. So that's how I talk to patients around exercise and activity. And I do think it's a very important component of this, but it's also important to realize that plenty of patients lose weight, reverse their diabetes, reverse their high blood pressure, and greatly improve their metabolic health numbers without doing any exercise. The food that we eat is the most important factor in this. And so that's what I focus on first and foremost.
Amazing. And maybe one last thing. I'm curious. I think when we chatted at the conference, you were mentioning you're carnivore, if I'm not mistaken, you carnivore diet, and we've never really addressed this on the show, but maybe even just speak to your personal experience doing the carnivore diet, because I won't lie to you. Even when I first heard about this, I'm like, what? You need your fruit and vegetables, you need the fiber, you need your micronutrients, you need something more holistic. But yeah, I'm interested to hear either how you got onto it and then your experience with it.
Yeah. So, I was about, probably 3 years into my metabolic health journey, and I had lost a bunch of weight, and I was feeling good. And I was on I would say at that time, what I would describe as a very low carb keto diet. And one day I came across this crazy orthopedic surgeon, Dr. Sean Baker, talking about the carnivore diet. And I was like, that's pretty interesting. But same thing, like you said, I'm like, you can't just survive on just meat, can you? But I was curious and I looked into it, and sure enough, you can survive on just meat. And we have historical records of this, and we have ancestral populations, and then there were plenty of people who were doing it at that time. And so I said, let me give it a try. Nothing's good, nothing to lose. 30 days of, carnivore, certainly I didn't think was going to kill me. So I said, let me give it a try. And it was interesting that I noticed two things right away. The first was I had been struggling with plantar fasciitis. And for years, every time I got out of bed in the morning, I put my right foot on the ground, and it hurt. And I would hobble around for about 10 minutes, and then finally it would kind of work itself out. And I had done all the stuff. I had done the physical therapy. I had taken anti-inflammatories. I had stopped running, all these things, nothing helped it. My third day on the carnivore diet, I got out of bed, I put my foot on the ground, and it did not hurt. And it didn't come back again. So there was something. And again, I was eating a very clean keto diet, no sugar, just some vegetables and, none of the vegetable or seed oils. Although actually at that time, I probably wasn't as religious about avoiding vegetable and seed oils. But whatever it was, something was still triggering that inflammation, and the carnivore diet got rid of it. And after 30 days, I felt great. And the other thing that I noticed was I was just not thinking about food anymore. I had spent my whole life, always thinking about what am I going to eat next? What shopping do I need to do? What do I need to plan? This and that. And the carnivore diet is just simple. You go once a week, or, you don't even have to do it that often. You buy a bunch of meat, you get home, you grab something out of the fridge or the freezer, you throw it in a pan for a few minutes, you're eating, there's no cleanup, you're done. And it just ended up fitting my lifestyle well. Again, being a high protein diet, I'm only hungry, once a day. And so I only have to eat once a day, and it just fits, well into my lifestyle. And it was low energy for me in terms of thinking about, what am I going to eat? So I've stuck with it now for over 3 years. But, again, that doesn't mean that I think everyone should or needs to be carnivore. I just think it's an option that we need to be presenting to people.
So interesting. And I asked you this at the summit, but just for our listeners, in terms of like getting enough micronutrients, making sure that you got enough vitamin and minerals, what's your thoughts on that with that diet?
Yeah, it really, the evidence is that, everything we need is in the meat. And, within carnivore, there's a big debate about whether you need to be consuming organs and doing kind of nose to tail versus those people who just say, just eat steak and you'll be fine. I go back and forth on that, but the evidence certainly seems to be the people who are just eating steak and not eating organs are doing just fine. So again, you look back at how we evolved, you look back at, just the sort of ancestral system that was in place, in that the animal eats the grass and the roughage and all of that stuff. They, especially ruminant animals with their 4 stomachs, are able to process that properly. All those nutrients end up in their meat, and we eat the meat and we get all those nutrients. And, at this point, we have a very large population of people who are, doing the carnivore diet. The online communities around the carnivore diet are literally in the tens of thousands. And we're not seeing people end up with, these deficiencies. And, we have some, people who have been on it for decades, literally, and have done fine. And like I said, similar to the heart disease, insulin resistance, question, it's interesting that you can go back in the medical literature and you can find the carnivore diet described. The most famous probably description of it is from the 1920s. An explorer by the name of Vilmer Stephenson, who was, with the Inuit for a year and survived on, or with the Inuit for an extended period of time. And he was on, a carnivore diet there, and he feels great. And he comes back to New York and he starts eating, the standard diet at the time, and he doesn't feel so great. So he says, maybe there's something to this. And he and one of his cohorts actually, check themselves into Bellevue Hospital at the time in New York. And for 1 year, they did a monitored carnivore diet. They were getting their blood work checked. They were getting vital signs checked. The first month or two, they were actually in the hospital, all the time. And then they went back out into society, but they maintained the carnivore diet and they did great on it. And they showed all their blood markers and everything improving. So it's just one of those interesting things where you start to say, okay, what we've been told around food, may not be exactly correct. And maybe we don't need 5 to 7 servings of vegetables a day. And maybe we don't need to be eating all this high sugar fruit. And maybe we don't need fiber to survive. And it just leads you again down that path of really questioning some of these basic assumptions that we have been told are unquestionable in medicine.
Wow. I must say, as you said, I always found this diet quite mysterious, and in terms of the approach and what to watch out for. But it's good to hear that your experience has gone okay, and I'm certainly interested in hearing more about it because it seems to be, if anything, gaining momentum. So last thing, this has been awesome. I really appreciate having you on the show. I really appreciate being able to share ideas and once again, Chadden was very much a like-minded individual in terms of preventing people wanting to prevent people from seeing us in hospital. How do people get a hold of you? Tell us a little bit about the book as well, and how people could connect.
Yeah, sure thing. So the book is called Stay Off My Operating Table. It's widely available, all the usual, online sources. My website, ovadiahearthealth.com, OVADIA hearthealth.com, has all the information about the practice and the book and my podcast and all the other things that I'm doing. And social media wise, I'm most active over on Twitter. I'm at iFixHearts. So people can certainly come connect with me there. I love getting, direct messages from people. I respond to almost all of them as I can. And so I would encourage people to come find me there as well.
My friend, this has been amazing. I can't wait to get this episode out, motivating more folks to stay healthy and to get healthy and know that they can reverse their metabolic syndrome. I just so proud of you, Phil. And once again, thanks so much for joining us on the show today.
Yeah, thanks for having me on. I look forward to continuing this conversation in the future as well.
All right, Quadcast Nation, thank you so much for listening. Don't forget to follow us on Instagram, YouTube, Facebook, or TikTok at Quadcast. Leave any comments at quadcast99@gmail.com. Leave that 5-star ratings on Apple Podcasts or Spotify, wherever you listen to a podcast. For real, we love you. Thanks for supporting the show. And we're going to connect again real soon. Peace.